Hello, my name is Dr. Nikhil Prasoon. I'm a consultant neurologist at Amri Hospital, Salt Lake, Kolkata. Through this video, I would like to discuss something about epilepsy. As we all know that epilepsy has been a malady which has afflicted the humankind since time immemorial. Now we are having a purple month, so I have decided to discuss with you certain pitfalls, certain myths, and certain misconceptions with regard to epilepsy. Because it's a common neurological entity, so there are so many aspects related to this. There are so many misconceptions and problems with regard to this. So this is our duty as a neurologist and also as a community practitioner in the field of epilepsy to let all our patients know about various aspects of this disease. First of all, I would like to highlight that epilepsy is a disease. It's a common neurological disease. There should not be any stigmatous notions attached with this malady. Now, it's a disease like any other thing. For example, high blood pressure, diabetes, and like that. One should not feel ashamed of the fact that one is having epilepsy. This is very important. And epilepsy has got varied manifestations. Now, in the countryside mainly, there are so many misconceptions. What is epilepsy? All the jerks that you are having, that is not epilepsy. And even if you are having one or two sporadic spells of unconsciousness or jerks here and there, that is not epilepsy. Epilepsy is a tendency to have recurrent seizures. And even if you are having epilepsy, there is no problem. Because there are certain drugs, there are so many drugs in the armamentarium which are instrumental in curing the epilepsy. And there are surgical options as well. So, through this video, I would like to give a glimpse about the do's and don'ts of epilepsy. Now, suppose if someone is having epilepsy, the first thing that one should do is not to feel ashamed. One should be confident and upfront, and one should tackle the disease with a brave heart. And the community physician and neurologist has got a very significant role to play. If you are having epilepsy, please let everyone know who are working with you that you are having a disease, so that they can be of substantial assistance to you whenever there is a need. You should tell your parents, they must be knowing about it, but colleagues and teachers, everyone. You should tell everyone. There is no problems with that. Besides, you should keep on taking your medications regularly, without fail, at the regular interval possibly, as far as predictable and possible. Now, there are certain other medical conditions associated with epilepsy. Before you are being started with certain anti-epileptic drug, you have to tell honestly to the neurologist or to the physician with regard to other medical conditions associated with this. Suppose if you are pregnant, you have to tell about the status. If you are taking this oral contraceptive pills, then you have to know, the doctor must be knowing about this because there are certain drug interactions with this. So these are the important things before starting the drugs. Now, as I mentioned, the drugs have to be taken regularly without fail. We should not afford to miss even a single dose of it because it can lead to breakthrough seizures. You should not compromise with your hobbies. There are certain misconceptions regarding whether we should swim or we should do cycling and all that. Now, suppose if you want to swim, you can do that, provided your epilepsy is perfectly under control. And you should not compromise on that. There has to be someone along with you. There must be someone. You should do swimming in a protective environment. Or if the epilepsy is not being controlled properly, and if you are not feeling confident, then you should avoid swimming as far as possible. For example, so far as cycling is concerned, now you can do cycling as well, but it is better to avoid cycling all alone. And you have to wear some headgear, etc. while cycling, then that would be protective. And besides, you have to avoid certain conditions like sleep deprivation. Sleep deprivation is one of the important factors which are instrumental in the causation of breakthrough seizures. Whenever there is a marriage, there in all likelihood you have to remain awake for long hours. That is one of the common precipitating factors that we have come across. So you have to avoid it. Now you should avoid fasting as well. You should not do unnecessary fasting. You should see to it that you take proper nutritious diet and balanced diet. If you should exercise regularly. So these are the certain preconditions, and besides the fact, the foremost thing is that you should feel confident and you should keep on taking the medications on regular intervals as has been advised by the physicians. You should not fall prey to all those countryside thugs and all those quacks who have got their own kind of mysterious treatment protocols instead of those scientific things. And you should know that even if the epilepsy is not getting controlled with 2 to 3 drugs, you should talk with your neurologist. You should not go here and there. You should go to the institutions, and then there are certain surgical options. There are certain non-surgical options also that you should get you have the right to get sensitized to. Now suppose you are having seizure, someone is having epileptic fit, then what should you do? What should others be told to do, and should others be told not to do? Now you are having a problem of epilepsy. I think the onus is on you and on us as well to make others who are related to you, or to make the community aware of the fact that what one should do while a person is having epileptic fits. I think epilepsy, if someone is having epileptic fit, one should not get panic. This is the most important thing. Everyone should not start running here and there with water and all that stuff. Just ask them that why, if I have anything like that, maintain a cool, calm environment. The light should not be that much intense and bright, and one should not try to stop the epileptic fits. You should not catch hold of the patient and try to stop the epileptic fit. It should go in a natural way. It is bound to wane off in most of the cases. And once the seizure is taking place, the patient should be left alone. There should not be anything, any spoon or anything like that should not be inserted into the mouth, because it may lead to trauma. And along with that, if the epileptic fit gets stopped, then the patient has to be, or the person has to be moved to one side, so that there is no problem with choking, etc. And if there is any particle, it has to be taken out. Before this, if the person should be avoided from falling, one should try to just catch hold of the person. There should not be any head injury. If there are any sharp objects around the person, it has to be removed. But the epilepsy should not be, one should not catch hold of the person, as I emphasized. And the person, if the epileptic fits gets stopped, then one should wait. Patient has to be turned to one side. Important, the saliva has to be cleared, and after that the patient should not be left alone until he gets his consciousness level to the optimum extent. So these are the certain important precautions, the first aid measures which are to be done. And in all likelihood, that if the seizure continues for more than 5 minutes or so, it could be a warning of status epilepticus, so the patient should be hospitalized, and proper institutional care needs to be initiated at that point of time. So these are the important things. Now, if someone is having epilepsy, one should not take, there are certain things, the irregular food habits. It has got an important implication nowadays. Excessive caffeine, excessive Chinese food, and all those stuffs which are having excess of monosodium glutamate, etc. These are to be avoided. These are the certain things that I have mentioned in this my brief interaction. So I would like that each and every patient who is having epilepsy, one should feel confident, one should face it bravely. All epilepsies are not incurable. There are whole gamut of epilepsies which are benign, which can be cured completely. Now there are refractory epilepsies which are not getting controlled. So there are certain surgical and other non-surgical options which can lead to annihilation of the problems created by this disease. And this is the responsibility of the society to be sensible and sensitive towards those who are having epilepsy, especially those patients, the small children having static encephalopathy, cerebral palsy along with epilepsy. It's a huge burden for the the household, for the family, for the mother in particular. So those patients need utmost care of the society at large. So this is our responsibility, and I would like to appeal to the society through this video to be sensitive to the cause. And another aspect is that these adolescent girls who are having epilepsy, their marriage negotiations are not proceeding properly. They are being looked at by the society in a different way. So they are bound to have an adverse psychological implications out of this. Now this is extremely unfortunate. I often come across the patients, the anxious mothers and fathers who are wary of the fact that the girl is having epilepsy. How would they start negotiations regarding marriage and all? This is very sad. I think if you are planning to marry your daughter or your sister having epilepsy, the first and foremost thing is that you should tell the to-be-in-laws about this disease. And if need be, you should make them talk to the neurologist or the physician who is treating the disease. There are certain misconceptions which are required to be got rid of before initiating this process. And there are several examples. Almost most of the cases of these adolescent girls with epilepsy, after marriage they are having a very productive life. It is not necessary that their offsprings are bound to get epilepsy apart from certain genetic epilepsies. So the proper counseling is required. Third aspect is while pregnancy. Pregnancy in epilepsy, it's a very important topic to be dealt with. And I think whenever a lady becomes pregnant, the proper counseling is required. The proper coordination between the obstetrician and neurologist is the need of the hour, because there are certain drugs which are required to be modified. The proper fetal monitoring is to be done, for example, at least by 16 to 18 weeks, so that the MTP can be considered in view of any anomaly. Alpha fetoprotein regulation, and there are certain drugs which are, the dose of those drugs may have to be decreased in the first trimester, again, increased to some extent the second and third trimester. And the vitamin K injections to the mothers in 36 and 38 weeks, for example. So there are certain things, so certain protocols which are to be executed in case a woman becomes pregnant. So overall, I would like to highlight that epilepsy is a disease on which a huge amount of research is going on across the continents. I think certain new drugs, whole lot of new drugs are coming up every 3 months, 6 months, like that. So we have got ample amount of hope, and I think we should not lose hope in our pursuit to cure epilepsy. And to conclude, I would like to highlight once again that the epileptic patients, they should feel confident. It is not something that they should feel handicapped about. They should face the society bravely, and this is the responsibility of the society at large and the treating physicians and neurologists in particular to respond to their cause. So in this occasion of Purple Month, I would like to appeal to the society to get sensitized to the cause of epilepsy. Thank you. Thanks a lot.